and welcome to another In Conversation. And today I have the privilege of talking to a dear friend, a passionate advocate, an incredible woman who I've had worked with on the board of UICC for 6 years and continue to work with, and she inspires so many people around her. So my pleasure to introduce Myra Caleffi. Myra, tell us a little about yourself. Tell us, where are you in the world? What do you do? Let everyone know what you do.
Hello, I'm so pleased to be here, Carrie, because it's like talking to my friends, talking to the UICC community that inspired me so much throughout my last 15 years since FEMAMA became a member. And time goes so fast. But if I have to tell you something about myself, I'm telling you that I'm a very committed doctor. I work 7 by 7 for my patients. And because of them, I've been doing all what I've been doing around the world and mostly at home. So I know that thanks God and my father that put me in this way to be a medical doctor, because I didn't think so. I was going to be a researcher. And imagine me being in the bench, not being with patients. So I think I found what really pleases me to do with my life, besides a bit other things that I like to.
We won't cover those things now, Myra. We'll talk about those later. But let's talk about you as a breast cancer specialist, okay? And you mentioned there that, no, obviously you became a breast cancer specialist, and then you, for whatever reason, what made you create FEMAMA? I mean, FEMAMA is an organization that we're very familiar with in Geneva, and many people around the world are. But what made you move from being involved on the medical side to form an organization which has become an advocacy platform in Brazil? What happened?
Yes, I think I have to go back to my studies when I was in England. I studied very profoundly the subject of how we can improve the survival of breast cancer patients. And when I saw for the first time that the curves could go down and not only up in the world, that inspired me to do something about breast cancer education, patients' education, awareness in general. So I came back to Brazil. I'm talking from Porto Alegre, Brazil. And I started this groups of patients, only just not formal. And then that already happened 25 years ago. So that was a local, became an NGO, but was not, didn't have much power in influencing public policies, because cancer is less now, still a domain of the federal government. So we live here in the south of Brazil. So how could we influence others? But then we started to group with other groups of patients or advocates or people that really want to do something. And the challenge was how we could do that, not having one only, because that, I don't know if you know, but I signed with my own name and bank numbers, all these NGOs, you know. But we started to find out a way to do that, and that was a federation. And so we put together, it's not an association like UICC, but very much like UICC, because that was one of my my inspirations, as I said at the beginning. So FEMAMA put together one only umbrella organization with aims to do advocacy. So I don't care about with other NGOs do with their own issues, local issues. But for us, it's important that we, every year, before it was presential, last year was not, this year was not going to be, but we kind of say what we want to do to fight together for. So that is I think a very important commitment that these NGOs they are not professionals, they are only volunteers, but is a crowd of people, like 1 million people working together, just in issues that we plan to do next year, to fight for next year.
It's certainly an impressive achievement to pull together such a community, and I know you've been working on it many years, but can you think of any particular highlights of achievement that you've in the past that's happened as a result of that joint advocacy? Have you achieved anything with the government? Has anything else come out of that?
Very many. And I think what I really am I can die, because I saw that at the Global Breast Cancer Initiative that we, with Ben Anderson and others, put together at WHO, is written there, the 60 days time for first diagnosis to first treatment. And this was a law that we passed, a bill that we passed here like 12 years ago, and is becoming now 60 days. Never, ever before, for at least to my knowledge, that the executive had to fulfill a bill that's coming from the legislative, to deal with cancer. And I wish other countries, and we're working together in Latin America, and helping people throughout the world to make this law to become true in other countries too.
So we've got the story so far from you being a breast cancer specialist, and then you start an NGO because you're passionate about making policy change, because you can see more could be done. And you just mentioned our friend Ben Anderson and becoming global. So how did you make that transition from being a national advocacy giant to becoming involved in global? What caused you to do that?
Again, it's like, I think when we leverage and we compare, because as a breast cancer specialist, we always been global, right? Because I publish my research, academic world is very rich. So I saw that there were other pairs that I could see throughout the world, at ASCO, at San Antonio, that I could pair with, I could learn with. And then when this UICC opportunity came up, not as a board yet, as a member, and then I register FEMAMA just for the sake of best practices experiences exchanges. I think is important. Collaboration. And I think really this gave us such so much power internally in Brazil, just because we are talking the same. So remember the first, very, very first, now we're going back to, I think, almost 10 years ago, that we had this amazing meeting, like snowing outside Geneva, was my first experience. And we started to go around panels, trying to think about breast cancer or cancer in 2030. We were like 2018 or even before 16. No, before. And then I always thought, look, this problem is global, but this solution is local. And that, to me, is very, very true for City Cancer Challenge, for everything.
No, you're absolutely right. I mean, one of the things that what we try to do in UICC is to maintain a view on the longer term issues, the issues that need to be addressed over the longer term, because we know that the majority of our community are addressing today's problems, today's issues, next week's problems. And within UICC, we have the facility to look a little bit longer term. Now, I know when you joined UICC, I mean, you brought energy and enthusiasm, but most importantly, I remember in a lot of the discussions, you brought the patient's voice into the discussion about the patient being important, the consideration, even though we were looking at the United Nations and we're looking at resolutions and NCDs and all these things, you were constantly saying we must build things with the view of the patient. It seems to be something that you are passionate about all the time. Is that a fair reflection of the way you address these things?
I think so, because I think we always very concerned about declaring our conflict of interest, right? So the patients have the conflict of interest. It's their own lives. You know, they need to sit on the table. They need to express what's important for them. Not doctors are not administrators, and they come with amazing solutions that are far cheaper than sometimes like feasible than that sometimes we think of. So I think lots of things changed about the voice of patient and from then to now. And I think Brazil is very behind many issues, but we have a strong voice here. We have strong advocacy here, and I always have to thank all the teaching that we had from ACS. ACS really taught us very much how to be effective when we're talking about legislation with legislators and senators, and I think all this. It's not only passion, Carrie, it's belief. I really believe that patients have to go, and they have to go in the front, you know, they have to go forward, and they have to study. They have to know about their disease. They have to know what they're talking about. It's not blah, blah, blah. So it's our, and yours too, UICCCO, to build capacity, to build knowledge, data, coming from patients also, because now we're talking about real world data. Well, patients are real. They are the ones.
No, you're absolutely right. And I think you express it well that, you know, we can't just be angry about the situation or passionate about the situation. We have to have the evidence. And we have to have the skill sets. And you quite rightly point out, the American Cancer Society over many years has done a lot of great training about good, solid advocacy processes and how to understand the legislature and how to understand to influence that. So, you know, I think we as a community, we become wiser to the ways in which to influence and not necessarily just rely on the passion. Myra, thank you very much. As ever, your passion shines through in everything you talk about. And I do wish you well with FEMAMA. We're very proud of you as an organization that's a member of UICC. And as ever, it's a pleasure to work with you. So please enjoy the rest of the day, and hopefully we'll catch up soon in Geneva.
Yes, I am hoping that they will let me in. As a Brazilian. As a Brazilian.
All right. See you soon. Bye-bye.